Finasteride and permanent impotency and erectile dysfunction. I am a 32-year-old male and was prescribed 1 milligram Propecia for male pattern hair loss. I do not mind having a typical low libido, but reading the frequency of incidences of people that experience permanent erectile dysfunction and impotency is frightening, and I'm reluctant to take this medication. I'm wondering if doctors had patients with such permanent and irreversible problems while on finasteride.
Thank you for your question. You state in your question that you're 32 years old, you received a prescription for finasteride 1 milligram once a day, and that you are not concerned about having a lower libido, but you are concerned about long-term erectile dysfunction, sexual dysfunction. And so you're asking about that as the relative risk for taking finasteride. Well, I can certainly share with you my experience with patients who I've been treating since the introduction of finasteride. A little bit of background: I am a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic and reconstructive surgeon. Hair transplant has been a part of my practice for many years, and I'm the founder of TrichoStem Hair Regeneration Centers. And we've developed a non-surgical alternative to hair transplant as well as an alternative to finasteride. And I'll go over that history a little bit. But just to first answer the question about the experience with patients having long-term erectile dysfunction and sexual side effects. I think that you've touched upon a very, very controversial topic. And I think that with the exception of a small group of people who have made this claim, and there has become a lot of, ultimately developed a lot of momentum in terms of the fear of taking finasteride, to the point where in our practice, people who come from all over the world to us for a treatment we developed called hair regeneration, which I'll discuss further later, they won't take finasteride. They categorically refuse to take it, or they've taken it and they developed side effects and they didn't like that. They got better after stopping the drug. I think when you're talking about long-term sexual side effects that occur in spite stopping the drug, I still think it remains unresolved. I find it difficult to be able to really explain how a pharmacologic process, when the drug is stopped, can continue. How is there permanent changes that lead to the inability to have sexual function? There's certainly a lot of opinions about it from the central pathways of the brain, etc., but I still think that remains to be determined. And given the number of people who take not only 1 milligram of finasteride, but there's a drug that's also used for benign prostatic hypertrophy called Proscar, which is 5 milligrams of finasteride. And then there's another drug that is dutasteride, also a DHT blocker. So I still think that from the medical perspective, the relative risk is very, very low. However, that being said, I can tell you that from studies done of compliance with these drugs, there is a real issue for the majority of people who seem to be taking it from within those studies, and that they'll take it for the first year and then not take it for the second year. And so, or just kind of taper off with time beyond that. And I've seen that in our practice. Clinically, patients will say they took it, they weren't sure it was working, they weren't sure if they weren't feeling right, and they just stopped taking it. A lot of times they just weren't sure that it was working, so they just stopped altogether, or they just decided that they didn't get around to refilling their prescription. I mean, there's just a long list of reasons. So, in fact, the point that I'm about to make as far as an alternative to finasteride that may be of interest is that around the time that this concern was starting to pick up momentum, we were actually using something called ACellular matrix to help heal people who were undergoing hair transplants, to improve the survival of grafts, to improve the healing of the donor area. The side effect was that thinning hair started to get thicker in a lot of different patients. So I took it upon myself to develop a system and process, and ultimately we call it hair regeneration. What makes this significantly different and has become quite a relief for people who don't want to take or can't take finasteride is that finasteride helps 60% of men, 40% it doesn't. But also it slows down the progression and doesn't stop it. With hair regeneration, with this injection that typically occurs at least once and maybe a second time at 15 months, depending on the individual situation, we're able to consistently have patients regrow hair that hasn't been growing, which are in a long resting phase called telogen. We're able to stop the hair loss progression. We're able to induce the shedding of thinning hair and the regrowth of thicker hair, which means that they're actually getting thicker hair without transplant and without taking any medication. So, needless to say, this procedure has become very, very popular, and people come to us from all over the world. And I've actually started a company called TrichoStem Hair Regeneration, and we're trying to work on building facilities to bring this technology closer to people who can't get to us in our 2 offices in New York. The point of that is that it is, I would say that when it comes to your decision, and this is how I explain it to my patients, if you're willing to take the finasteride, go ahead and take it. Statistically, it's unlikely that you'll have issues with sexual function. The majority of patients clinically who I've treated who had any issues with sexual side effects were able to stop the drug and were back to normal. I have not had a single patient have a long-term problem with the sexual side effect. Therefore, after the cessation or the ending of the drug. Therefore, from my clinical experience and from the clinical experience of colleagues who I discuss this concern with at meetings, it has not been something that we have actually had a significant consensus agreeing that there's a commonality, and which is also unusual. In clinical practice, whether it's a drug, whether it's a device, whether it's a technique, doctors doing similar things will often share similar experiences. And so this problem of not having good sexual function after the ending of the drug is highly unusual, and so, as I said, needs further investigation. So I think this was an opportunity to put into perspective the drug in terms of long-term sexual side effects, as well as the alternatives that we've been very successful to help people who just won't take the drug or cannot take the drug. So I hope that was helpful. I wish you the best of luck. Thank you for your question.